Hello everyone. Hope you are all doing well. Welcome to PharmaWiki. This is Purna you're talking to. And today let's know medical sales representative important questions for the interviews and even for the entrance examinations. Hmm. This will be helpful for freshers and also experienced people. Let's go to the main part of the video. There'll be 30 questions in this video so that you can listen to, and even if you want to read the questions in PDF format, it will be available in our website. It is pharmawiki.in. Okay, before starting, let's wish you all the best. Okay, let's start with the first question. Who controls the pharmacovigilance regulations on adverse drug reactions events in India? Option A, Central Drug Control Organization. Option B, National Pharmaceutical Pricing Authority. Option C, Indian Council for Medical Research, ICMR. Option D, Central Regulatory Affairs Division. First I thought it's Central Regulatory Affairs, but it's not that. It's Central Drug Standard Control Organization, CDSCO. This will control the pharmacovigilance regulations on adverse drug reactions in India. Okay, the next question we'll be moving to is, to which of the following should an medical representative sell the products? To the pharmacies in the area or registered pharmacy only? Any new pharmacy, retail shops? Yes, it is registered pharmacy only is the correct answer. Answer B. How can market information on pricing of competitors' product be gathered? This is very important question. You have to know if you want to take a career in medical representative thing. So this is how can market information on the pricing of competitors' product be gathered. It's by contracting with the competitor's head office, or by discussing with the distributor, by discussing with the pharmacist, or by contacting the competitor's representative. Yes, it is only through the distributor. Yes, exactly. It's B, by discussing with the distributor. The next question, fourth question, we'll move. It is, what is the best method to gather information on competitors' delivery schedules? Monitoring promotional camps, monitoring distributors' activity, monitoring selling activity of pharmacists, or monitoring prescriptions of the doctor. The best method to gather information on competitors' delivery schedules is monitoring distributors' activity. Okay, let's move on to the next question. Whose activity should be monitored by MSR? It's competitors' activity. You should always be monitoring by the medical rep. What is the best used method to find out competitors' pricing? It's nothing but search engine. Yeah, you Google it and do it. That's what it tells about. And the next question is, how health service activity monitored in a specific area? By attending the conferences or by interacting with the pharmacist? Yes, it's by interacting with the pharmacist. Let's move on to the next question. Which one of the following is the best method for identifying the potential client base? It's by attending the regional conferences. Yes, it's by attending the regional conferences. Where should a medical rep monitor health services activities? It's within the specific allotted area. They have to mm, they have to monitor the health service activities. It's not that all the areas you have to cover, or all the hospitals on the geographical areas, or the pharmacies on other geographical areas. It's nothing but you have to do within the specific allotted area. And the next question, we move on to, which one of the following is an after sales service to a health service center? It's delivering pending orders. How does a medical sales representative brief the technical data during the meetings? Yes, this is most important question. If you don't know this question, you have to know it, because definitely this will be one of your question in the interview or an exam. Yeah. By presenting the customer's profile? No. By presenting a list of customers met? No. By presenting the number of visits made? No. It's by presenting the product literature. Okay, this is how it will do it. How does a medical sales representative brief the technical data during the meetings? It's by presenting product literature. Yes. Who is the key contact person in a hospital to be consulted for sales improvement? Yeah, it's purchase in charge. It's not the HR in charge or the administrative staff or a nursing staff. It's just the purchase in charge you have to consult. Okay, let's move on to the next question. Who is the contact person at the front office in a hospital? It's the receptionist. What should an medical rep do when a physician looks convinced with the product? Yeah, it's obvious that he should request him to prescribe the product. How can a person become successful in medical representative field? Good network with the dealers and the pharmacists is the main part you have to do if you want to be a successful medical rep. By this we have completed 15 questions. Let's move on to the 16th question. How should the latest clinical data be presented to a healthcare professional? By highlighting the offers on the product? No, not at all. By explaining the cost impact against the competitor's product? It might seem okay, but it's not that. By emphasizing on the salient features of the product? Yes, only you have to concentrate on the salient features of the product, not about the cost or the any offers or anything comparison to the competitor, anything like that. It's just emphasize on the salient feature of the product. What type of data should be discussed with health professionals during a presentation? Latest clinical data should be presented for the health professionals. What should an medical rep do to improve his professional knowledge? Read the educational literature, read the latest pharma publications, interact with the patients, visit hospitals regularly. From this, the best option is B. Read the latest pharma publications. Which of the following should an MSR refer for general information about a drug regulatory requirements? As already we discussed in the first question, it's Central Drug Standards Control Organization. Okay, what is the full form of FDA? This is easy peasy question. Food and Drug Administration. What is the basis of recommending changes to the company products and services by medical representative? It's not by interrogation of the patients or taking inputs from the subordinates or considering the discounts offered, but it's by analysis of the market data. Next, move on to the next question. Which data should be analyzed for the product improvement suggestions? It's by product specific market information. How can a retail chemist prescription audit as a medical representative to improve the business performance? It's by recommend required changes in the product. This is how medical rep can do it. And then what helps the company changes to products and assets? This is the feedback from the customers will definitely help the required changes, recommended changes. What factors are considered while preparing travel plans to an outstation location? Yeah, you have to know about that availability of the doctors, pharmacists, and also dealers. All the three availability you have to get and plan accordingly. How is an appointment with the doctor arranged? Yeah, by calling the doctor and confirming his availability. With whom does a medical representative discuss the needs of the customer? is with the manager, public, receptionist, or the doctor. It's obvious that we have to discuss only with the doctor. What strategies are developed in increase opportunities to meet and connect with contacts in the healthcare sector? Yeah. Offer product subsidies? No. Offer free medical checkups? No. Exhibit advertising boards? No. And it's by organizing group events. What is the purpose of using visual aid for product presentation? To increase presentation effectiveness. Okay, and the last question, what is the key factor to give product demonstration to the customers? Yeah, there's to highlight the USP of the product. These are the 30 questions you can revise here, and if you want to uh, learn it through the PDF format, you can see it in our website pharmawiki.in. We'll give the link in the description below so that you'll find it there. And thanks for watching. If you want anything in particular, you can just comment us down so we can provide those interview